Welcome to On the Beat. Today I'm joined by Columbus Starkville Gastroenterology Associates, and I am sitting with Dr. William Gillespie and also Dr. Richard Hurd. And today a topic that we hear a lot about, and it's scary when you hear that word, pancreatic cancer. So many people say when you hear that term, it's at a point where it's in a dangerous stage. So tell us about what to expect with that diagnosis.
Yeah. It really depends on what type of pancreatic cancer you have, and I think that's a common misconception. The bad one that, a lot of people are scared of is the pancreatic adenocarcinoma, but also there's other types that you may have had friends or relatives who've had, that's pancreatic neuroendocrine tumor that's more treatable and is not as scary.
Because I don't think a lot of people know there are different types. So what are the symptoms that people would come to you with?
Typically they'll come in, it can be all sorts of things, and frequently we'll see pancreatic cancer when it's already far advanced and they haven't had any symptoms. But the most common symptoms are abdominal pain, typically kind of in the middle upper abdomen. You can get jaundice where your skin or eyes turn yellow from blocked bile ducts, and typically people will lose a lot of weight without exercising or dieting. Sometimes you can get new onset diabetes, but a lot of the symptoms are nonspecific and can be caused by a lot of different diseases and not just pancreatic cancer.
So many times symptoms there, and then talk about how sometimes it's to a point where you don't have any symptoms, but yet you have pancreatic cancer.
Yeah, well, a lot of times, so it grows very quietly, first off, especially both types do, but, and a lot of the symptoms that you might have from it might be very subtle, and you might not go in to seek care for it. Some of the more alarming symptoms, like your eyes turning yellow and jaundice and that kind of stuff, happen at a very advanced stage. And what's so scary about it is, there's not much you can do to screen for it up until that point. You just got to be very diligent about the symptoms that you're having.
And so how do you diagnose pancreatic cancer?
There's different ways. Generally, we start with imaging, either ultrasound, CT scan. There's some endoscopic procedures like endoscopic ultrasound. Sometimes we can go in the bile ducts to get samples, things like that. But frequently it's initially diagnosed with imaging, and you kind of see something on the pancreas or lab abnormalities, that sort of thing.
And treatment? What are we looking at?
Yeah, so it depends on the type, but a lot of times there's some combination of surgery and or chemotherapy. Again, if you're looking at pancreatic adenocarcinoma, the bad one, it just depends on what, around it has grown into, how big it is. There's several factors that might qualify or disqualify you from surgery. And
probably the biggest lesson is if you have any of those symptoms, make an appointment with you to get that diagnosis and to know for sure.
And also about 20% have family history or some sort of genetic link. So if you have a family history of pancreatic cancer, have a really low threshold to go get checked out.
Okay, great information. Thank you so much. That's today's On the Beat.